Good day. I just wanted to welcome you all to the Business 201 session and also to specifically talk about leadership. Physicians are uniquely challenged in the leadership role. They have an assumed leadership responsibility early in careers, partly because of credentials and background, but often that's confused because they have rarely taken the time to develop not only their own leadership skills, but their own competencies in that leadership space. So I'm Don Taylor. I'm director of the Alliance for Physician Leadership at the University of Texas, Dallas. Along with that, I'm got an appointment as a professor of practice, which means they give me credit for time served in healthcare. I'm also an adjunct professor at UT Southwestern Medical Center, where I teach there in the graduate school on the U.S. healthcare system. So first of all, let's just say, why me? Often they look at me and go, why are you talking to docs when you're not even one of those ourselves? Well, let's just say I'm an enthusiast. I've been around docs my whole career. I've been in healthcare over 40 years. Um, I uniquely am around right now. I say I'm a husband, father, grandfather, stepfather, and son, by the way, which teaches me a lot about healthcare. I'm still navigating my mom. Yes, I'm a mother's parent right now, and unfortunately, she drives at night in her late 80s. So that's something I have to watch very closely, but she teaches me about healthcare from her point of view. I'm retired military. As you can see a couple of the photos, I served in all roles up and down the system, all the way from administrator to small functional area, all the way to the COO of the largest academic center in the Air Force, as well as the only non-physician to command the busiest trauma center in Iraq. That's a unique responsibility I had during the peak of the war in 2006. In the private sector, I've been CEO, COO, entrepreneur, tried them all, had fun with some, didn't have fun with some, been for-profit board advisors, nonprofit board at the national level and community level. Uh, my background's unique in that I have an undergraduate degree in architecture, and I started my career designing hospitals and clinics and was not satisfied with that and understood a little bit more about how they design the healthcare system itself and how we decide that that's the hospital we need or the clinic we need in this place. But I will tell you that skill taught me a unique way of thinking about everything becoming a design problem. So I see today's workforce, physician workforce, as a massive design problem in a very messy world of healthcare with not a lot of help for you in your journey. So we'll just put it at that because I'll talk more about what that means in a moment. I think a lot of service in healthcare is about teaching and about giving back and about purpose. I had rich purpose when I was in the military. And I can tell you as I navigated through all of those other roles, I was difficult for me to find purpose in for-profit settings, difficult to find purpose when there was a lot of politics and agenda and egos in play. But I can tell you, since I have started teaching and I'm back in the university level, I have found my purpose again. And I say that because I want you to understand to sustain yourself in a happy career, you have to navigate toward your purpose at all times. That will be the core of your leadership journey. And you will be challenged often on that because you've been taught one way, the industry will try to lead you somewhere else. And my role, I believe, is to create a system, a process to help you navigate that really turbulent path between starting right out of school all the way to what it looks like at the end of your career as a physician. I'm blessed because the platform I have allows me to speak and allow to do conferences. And I've authored one book, working on another now about physician well-being. I hope to have it published in the fall with a partner called Healing. And it'll be about the unique elements of physicians needing to heal themselves to serve others better. So, but the bottom line is, I kind of like to tilt windmills a little bit. I like to disrupt things. I'm a champion for the well-being and what I call the goodness in healthcare and health. And I like to champion those that do the same. So I represent the Alliance for Physician Leadership at the University of Texas, Dallas. This picture is unique because this is actually one of our classrooms. And this is the way we teach. And I want to talk about that in just a moment, but I wanted you to get a visual for what the room's like. These tables become small subsets of our community, and this room is essentially a mastermind for executive physicians to learn how to work in the healthcare space, not just in the organization they're in. And I can tell you in this picture right here, I could point out the national chair for organ donation out of Chicago is in this chair. Another guy is an IT consultant with an entrepreneurial company right now. Another one just moved to Cleveland Clinic and is a CMO in Cleveland Clinic. Another one is a national expert in childhood epilepsy and is published and granted in that space. And then another one is a network CMO for Hospital Corporation of America, just out of this picture. That's the beauty of this classroom, because where else would you get that grouping of physicians with different specialties, different demographics, different geography, to sit in a room and openly trust each other with their stories, their vulnerabilities, and their concerns? We create that environment here, and that's why we're unique, and that's what I believe the path ahead is for physician leadership development. But before we talk about all of that, let's talk about healthcare. What the hell happened? You think about what's going on today. I mean, we were churning along. Healthcare was making a lot of money. I mean, it was hard. It was a little impersonal. And then we had a pandemic. The pandemic revealed so many things, not only about ourselves, and I say it that way because I sort of say the pandemic was God's given time out for mankind. We either took advantage of it or we wasted it. And I'll tell you many ways I wasted it, because I didn't get to do all the personal development things I should have done. I was enjoying my commute, walking by the coffee pot every morning. For goodness sake, I didn't even wear long pants for 2 years. I taught from my office, and I probably didn't take advantage of things, but the healthcare system did. The insurance companies thrived. The drug companies thrived. The specialties in some areas thrived. Primary care was neglected. Public health was beaten up. A lot of things were challenged. And the population itself, we still haven't healed from this. And in many ways, I think we've emerged angry. Angry as a society, angry as a population, just angry with a level of what I call disrespect that I believe is related to health. And we have to find a way to do that. And you're going to be at the front line in that discussion. So welcome to medicine. Oh, I mean that in a great way. But what did we learn? Well, first of all, and you're going to be responsible for this, the United States population is unhealthy. Just bottom line. COVID affected us disproportionately to the rest of the countries of the world because we're a sicker population. There is no certainty. We always think, and we've taught our own population to think that science and tech can fix it. We all sat around going, flatten the curve for 2 weeks. Surely there'll be a vaccine in a moment. Well, you know what? It took a little while, but it actually was rather quick. But the point is, there's no certainty now. And if you look in our world today, there's certainly uncertainty. We're frustrated, a lot of anxiety, a lot of fears. We also learned politics kind of get in the way of truth. That's going to be very prevalent in medicine. And if you track it, you can see that is still the case. Where is the source of truth in medicine? We keep searching for that. I'm searching for it. Learned a little bit about Americans, our anthrocultural values. Americans are just, a little bit stubborn at times. You're not the boss of me. You can't tell me what to do. This is a public health risk. Are you kidding me? I'll do what I want to do. We talked about that even for instance, just masking, for goodness sake. Masking? Yeah. How much compliance do we have with that? How much pushback do we have with that? Just in a simple act that, for instance, Japan, they've been doing it for decades out of respect for others. I tell my classes, when I teach, I said, I don't care if you wear a mask or not, but I choose to wear one on the airlines when I fly. I have a big, ugly N95 mask that really looks lethal in some ways. And they go, wow, are you afraid of getting sick? And I go, no, I'm not afraid of getting sick at all. When I put it on, nobody talks to me. I get to read my book and I get the armrest. Nobody crowds my seat. I get to do what I want to do. So there's many ways you can use that mask in today's society. Anyway, integration and interoperability. You're going to be faced with this right away. We don't do that well. Remember, even when we claim cooperation, we're still competitive in every market in healthcare. Supply chains are broke. They're still broke. We don't know how to even begin to fix supply chain. Preparedness. We were the #1 nation in the world out of 190 developed countries 3 months before the pandemic. And we failed. But yet we aren't embracing the lessons learned. We have already moved on to the next crisis du jour. This is the whole list of lessons learned that we aren't addressing. We exposed inequality. We're trying to fix that quickly. And then, goodness sake, we can't even talk about data, information, and knowledge. And now we have AI added to that. That's using all of those three things to perpetuate or pretend to be intelligence. We have a risk here that's emerging. You'll be right at the beginning of that. Where does AI fit in your world? Should we embrace it? Your patients will. Your staff will. What are you going to do? Will it even replace you? Don't know. It certainly will augment you. The staff and workforce well-being, we've talked about that. Burnout is real. It will happen, and it will continue to affect the way you do business. Healthcare is pretty big. Probably doesn't have the courage to change. Insurance is going to change your world. You need to understand that in time. The patient needs are changing, as I said, with AI and with their access to information. Their needs and expectations are not going to be questionable. I mean, there's no uncertainty. They're going to bring it right to you. They're going to bring it with printouts into your exam room. Then we have the issues of ethics, which were challenged during the pandemic. And then it's a whole semester to talk about the issues in public health. But we need to focus more on how that links to medicine rather than keeping them separated as we do today. So my point is, we had this opportunity a few years ago through the pandemic to understand a bit more about the fractures in our health system, but we didn't embrace them. Your challenge will be to begin to embrace those. We need leadership. We need physician leadership to do that. That's the voice that's missing in the equation. So you're going to have a very unique journey. First, I would just say, take a breath and celebrate your success to this moment. You're all right. You're there. Just take a breath and celebrate that. Don't rush to the next thing too fast, because you really need to understand and pat yourself on the back for what you've done. Too often, I've seen physicians move too quick to the next phase, and they've missed this moment to sort of celebrate and recognize who they are, what they've achieved, and by the way, to recognize those that supported them on the journey. That's a big deal to do that. Remember, you didn't do it alone. You did this with many others. In the first phase of your career, though, I would recommend you master your clinical skills. If you want to be an effective leader later on, you need to have mastered clinical skills. You can't bypass that. You can't just jump to the next phase and go, I want to be in charge now. No, you need to master clinical skills. You need to understand how healthcare works and doesn't work right at the ground level. Also during this time, though, it is time to build a trusted community of peers, friends, and advisors. This is the time you reach out to mentors. This is the time you work with peers you trust, people you can be completely transparent with. And it probably isn't family, it's probably not coworkers, and it's probably not your boss or your subordinates. You need to build a community that you can reach out to in a time of need, because it's important you nurture these relationships before you need them, and you will need them. There will be a moment when you have a bad day, you'll need to call somebody, or you'll have a challenge you have at work, you'll need to call somebody. Well, who can you call without being judged? You need to be a resource for that person as well. The other part is, if you ever think about changing jobs, they will always, always be found in your network. Cold applications aren't working any longer. The world of connectivity is just too tight. Your network is where you'll find your next opportunity. And that's, by the way, is the best opportunity for you to move forward. Now, here's Don's advice based upon the physicians I've worked with and the ones that are in our program today. I'd say at about 12 years, you start, after you do your clinical work, start thinking about the next phase of your life and career. Where do you want to end up? What would you want it to look like? Do you want to be in a leadership role, or do you want to stay clinical? Or do you prefer to stay in research or do more research? Do you want to start your own business or be part of a business? Some people are wired to take risks, some aren't. What about academics? Do you want to teach more? Do you want to become a program director? Do you want to advance inside your specialty? This is the part where you start thinking about what's next. Now, I will tell you, in all of those roles, you'll need to think about enhancing your leadership credentials in every one of those roles. You have to always prepare to lead. Never stop learning. Never stop learning. Because you always have to be prepared to lead. Your advanced degrees, advanced credentials, and giving back will be the last phase of this. We'll talk about that in just a moment. So here at UT Dallas, the Alliance for Physician Leadership exists inside the Executive Education Program in JSOM. So we have, and that's a video that'll be available to you. You can watch on your own in the PowerPoint deck as it goes through. We are a unique program in the nation. We're hybrid learning, hybrid by design. We're among the top 10 in the nation right now for physician education. We have over 100 active, what I call executive physicians in the program. We offer 3 degrees at this moment, an MS, an MBA, and an MS-MBA degree, which is a combined degree. I will tell you now, 90% of our physicians today are either doing the MS or the double degree option. We also offer an informatics leadership certificate embedded in the program. If you complete the MS MBA, that's automatic inside that program. Today, I'm accepting admissions for early 2025, and these are primarily people who've been 15 years or so out of residency and are looking to move into that next leadership role. We're unique because our faculty, as I call it, seasoned. We've been around the block a little bit. We're not academics. We've all been in healthcare. We have stories to tell that are happy and not so happy, but we share our scars openly, and we create a learning environment in the classroom that's unique. As you saw the picture earlier, in the picture here at the top, those classrooms are capped at 50. They happen every other month for 4 straight days. It's a very casual environment, first names only, but disciplined and respectful and completely confidential. And by the way, because of the variety and diversity of the classroom, the stories are shared openly. You talk specific issues with your employer or with your own department. We share stories, and it's all taught in the healthcare industry specific area. So we teach MBA topics in the healthcare context. And it's a very unique culture for physicians. My number one complaint for the docs that leave is that it's over, because they miss the culture and the group and their peers by coming back every other month. That's why I offer the double degree, because they can stay around a little longer. And of the 100, by the way, 35 of those are in the double degree, as I said earlier. We also, though, have started a new partnership with the Dallas County Medical Society, where we offer a certificate in leadership. For most of you, this would be the option for you early on. By mid-part this year, we'll be taking applications for this. It's a 1 Friday every other month throughout the year 2025. And we teach you here how to lead in the clinic level. This is basic skills for the actual clinic operations. It's a great preparatory certificate before you would go into the MBA side. This partnership, we've started with DCMS. We're talking with others now, and even industries talk to us about offering this inside their program under a white label. I've also developed a partnership with the Physician Leadership Career Network. This is a jobs program that'll be available to our APL physicians and alumni, of which we have 550 alumni nationally right now. One of them is a U.S. congressman. And that network is available and accessible to our graduates. We're just now energizing it with newsletters and annual events that we're working on as we speak. This Physician Leadership Career Network, we are also doing an online, how do I start the leadership journey, where that will be available, we hope, by the end of the summer, It'll be an online 2 hours a month session for 4 sessions to teach you how to prepare to lead, how to get your resume in order, how to keep your social media, let's just say, attractive for leadership opportunities. And then how do you prepare yourself actually, and how would you even look for the next opportunity? But the point is how to get your mind ready to lead and for preparation for all of this, because sometimes this takes you start maybe a decade before. We're going to do a global class because I think to do this right, you have to reach internationally. So we're going to do a class in Switzerland in June of this year, our first one there. And we have a great relationship already with the UN, WHO, Swiss government. We're going to have a fun week, and we're going to break away for cheese one afternoon. But the whole point is, this is about learning internationally, and our program needs to be recognized internationally as well as the physicians from our program, because rarely do US physicians get an experience of learning there. And we can tell you they're already intrigued by being able to talk to our docs. So it's going to be a great program. We also, as kind of the end of the journey, we're going to be creating for a year from now a certificate program for physicians who want to serve on boards of directors of healthcare systems. It'll be unique to doctors. It's the first in the country. And we'll be developing that. It'll be a 4-day session. So look for that in the future. But this is really, as you've moved through a cycle and had a significant leadership role and are looking to do something in the give back phase of your life. We just want to make this available to doctors throughout the nation. And then, of course, out of our group, we have a women's group. And this is led by a group of women, a master facilitator, who looks at women's issues and the women physicians' issues that are unique as they try to navigate through the healthcare system, which, by the way, they are different than the men. And we recognize that in our system. So if you have an interest in this, this QR code goes right to our website. You're welcome to take a look at it. You're welcome to challenge me and talk to me. Here's my email address, dontaylortx@gmail or don.taylor@utdallas.edu. And you can see the www.donald-taylor.com that goes right to my LinkedIn. Connect, ask me any question you want, call me anytime. I'll be glad to have a conversation with you about your unique path and how we may support you on that journey. I want to thank you for your time today. I want to thank the group and Dr. Cockerell, for everybody for setting this up. I think it's a great start. It's a great place for you to understand a little bit about yourself and a little bit about the challenges ahead. And frankly, the key is getting started right. And I think leadership also needs to be started right. And I hope I can help you with that. Thank you.